In this video, I'm going to do a deep dive into the world of acupuncture. I'm going to tell you everything there is to know about this service. Now that's a complete lie. I ain't going to tell you nothing about acupuncture. Instead, I'm going to get Gemma, our in-house acupuncturist, to come and tell you everything you need to know about acupuncture. I've said acupuncture quite a lot of times now, so let's hit the video and see if you can gain something about how acupuncture can help you with some of the things that might be happening. Tell me what is acupuncture? And I'm going to answer first with what is physio. Physio is a profession which is designed to improve musculoskeletal joints normally to get them better, make them feel better and reduce pain. What does acupuncture do then?
So acupuncture is actually a preventative medicine. So in an ideal world, and how it was obviously in China, was to prevent illness. So that's really important because we don't really think about that so much in the West. So yes, we can obviously treat disease, but even better is to treat a healthy person and keep them healthy.
Fine, okay, so we could argue that physio prevents injury.
Yeah.
What does acupuncture prevent? What would you use it for, to prevention of what?
Yeah, so your focus is musculoskeletal, whereas our focus is the whole body.
Okay.
So every function, so the digestive system, the reproductive system, the emotional system, everything, whatever else I haven't mentioned, lungs. So we look at the body differently, so we don't look at it, as an arm, a leg, whatever. We're looking at the functions, your normal, so how you present today. So for example, is your normal that you sleep 2 hours a day, or is your normal that you sleep 12 hours a day? Is your normal that you bowels move once a week? Is your normal that your bowels move once a day? Whatever your normal is, doesn't have to be a problem for you, can be actually okay. That tells us where disharmony is, and that forms the treatment.
Okay, brilliant. So I'm going to follow on for a few minutes. I've got all these questions, I haven't needed to use them yet, but you're making I really like your points, because when we, again, looking at physio, we try to prevent injury, but most of the time we see people at point of sickness when they're in pain or hurt. And life is much easier if we can prevent. In the physio world though, and you may have already alluded to the answer to this, but in physio world, there are metrics that people should, and I keep using this as kind of what data and evidence shows us that someone should be able to do this, which is then going to lead to the lowest risk of injury. We can't prevent injury, we can really reduce the risk. Now, if we then think of, from an assessment point of view, of someone who hasn't considered acupuncture before, because if someone hasn't considered physio before, I could say, right, well, I'm going to use knee strength here and knee health. You should be able to leg press 2.8 times body weight to have good knee health. Is there certain metrics that you would use in acupuncture that would be able to, for people to be able to identify? So short of, well, this isn't normal for me. I usually sleep 6 hours, but for the last 3 weeks I've only been able to sleep 2 hours, say. Are there, let's say I sleep 6 hours a day, and that's my normal, but if you look at data, everyone should sleep 8 hours, and I don't know if my sleep is actually good sleep. You hear about good sleep, bad sleep. Yes, I sleep, but are there certain things that you're able to test or assess for someone like myself? So I'm giving you, let's use me as a real life example here actually. I sleep 6 hours a day, I sleep fine, but I definitely don't get enough sleep. And what I don't know is how good my sleep is. So would there be things that you can do to help me? Because in my head, I'm already thinking, right, that burnout has got to come at some point. I'm not unaware of that, and I'm trying to put things in place to prevent that. But how could you help me in that specific situation? Can we talk about that?
So first of all, we would never just isolate one symptom, but by just focusing on sleep for now, what we would want to know is, okay, so 6 hours, so can we get more? Yes. So for example, is your 6 hours, is your sleep not as good because you're, for example, I'm simplifying, but too hot or too cold? So
as in room temperature?
As in internal temperature, for example.
Fine.
So if a person has too much heat in their body, then that can create restless sleep. So, but it's all relative. What other signs do you have? So for example, if your sleep was light and tossy and turny, restless, you also had night sweats, and you also had quite vivid dreams, that would be one diagnosis that would lead us to treatment. Or is your sleep light, you wake up feeling groggy, you've got phlegm when you wake up, you don't really dream much, but you're just feeling very heavy, for example, and you're tired during the day, but you can't sleep at night, that would be a completely different diagnosis and with a very different treatment.
Fine. Okay, that all makes sense. So, with what would an individual be looking for then? Is there a specific thing? Is it always down to it's just not usual? Because the situation you're explaining there could be my usual. That could be my normal.
Yeah, and you might have had that first 30 years.
Yeah.
And the question we always come back to is, can we improve, right? So I guess you could say, because what you actually asked me is there any metrics? And okay, we have an idea of a perfect person or a healthy person, should we say, which we could all aim to be at. And obviously external and internal environments, like, affect that.
Yeah.
But, what was the question again?
About how I could improve,
Yeah, so the question is always, how can we improve? Like, what can we improve?
Right.
Like, without going, without you having to resort to caffeine or whatever, or, I guess the question is, like, should I have acupuncture? Well, do you think your digestion could be better? Like, do you think your sleep could be better?
Yeah.
Could your energy levels be better? Could your concentration be better? If you could be better functionally, you don't have to know how or why, then introducing regular acupuncture can be really helpful.
Okay then, and so let's lead on from that bit there then. So I've made the identification in me. I could give you multiple areas in my life where it could be better. I'm sure my sleep can be better. I'm sure that everyone's digestion can be better. Like, there's no way that I couldn't improve on what it is. So in theory then, and I'm going to caveat this with physio, I believe everyone should have physio.
Absolutely.
I think it would be fantastic to be able to identify the problems early, intervene, and use these kind of metrics we spoke about before to prevent the problem. Should everyone then, in theory, have acupuncture?
Yeah, in theory everyone would, and in theory it will be available to everyone daily even, and I know that sounds excessive.
No, not at all.
But
Physio is the same.
And the thing is, and it boils down to what we do in a day. So, having regular acupuncture a week is amazing, but if you're also not following the guidelines essential for you, your environment, again, your results are going to be less. So we have to take responsibility. For example, we already live in a cold, damp country, which means that our internal environment is very susceptible to cold and damp. Think like pain, arthritis, tired, fatigue, heaviness. So we need to do what we can to help that. So diet's really important, and that doesn't mean like restricting calories. It means completely the opposite, to be honest. Most people need to eat more and eat better. So soups, most people, cooked foods, warm foods is going to help them straight away without even seeing them. Most people eat too much raw foods, cold foods, sandwiches, salads, wraps. It's not good enough. That weakens our digestion. Our digestion is everything. It's our earth, it's our centre. Everything comes from that. Chi, blood, movement. You could say earth is really where it starts. You could say kidney as well. But yeah, so we have to take on guidance, just like with physio.
Yeah. Well, I'm thinking about with things that you're saying there about I'm going to keep using the knee because it's a simple analogy to use. When I talk about the leg press and the 2.8 times body weight is what we expect people to be able to do for 8 reps to have a healthy, strong knee.
Right.
But there are caveats to that because there are individuals who cannot do 2.8 times body weight, but they have no problems with their knees.
Right.
The counter to that argument is, but you might have it, but they could come back and say, but I might not have it. And there's this kind of thing where we go, well, okay, well, do you want to take the risk? And it almost becomes not a fight, but you can go back and forth. But one of the things I always say to people, especially when they're injured, is that if you should be able to do, especially if they have an operation on the knee, we talk about you need to be able to get to this metric, especially if they want to get back to sport. If it's someone who just wants to walk around, you should be all right with just being able to get to basic numbers. But they will often say, well, I couldn't do that before I injured my knee. And we always turn around and say, but that may be why you've injured your knee. And so from an acupuncture point of view, is there, how would you convert that example into an acupuncture scenario where someone comes in and says, well, I never used to do that. And I don't know if I'm wording my question particularly well here, but what I'm trying to get with this, because that is my example of why people should do physio and have the knowledge and understand that these are the numbers that you should be able to hit to really reduce your things. And is there a way that people can look at acupuncture from something that you say to go, you know what, that's it, that makes sense to me now? Because my biggest fear of acupuncture is people don't understand enough about it. Listen to what you're saying there and the whole prevention thing. It makes perfect sense.
Yeah.
Like, everyone should be having it the same way they should have the physio side of it, but at the moment they don't, and it's almost like the why. What is missing between our communication and patients' understanding? Like there's a knowledge gap somewhere, and I guess maybe my better question is what's the barrier to people seeking acupuncture? And because coming back to my knee example, it's a really easy metric for me to measure. The question is, can you do it? And they're like, still can't do it. Okay, keep trying till you can do it. And then once they hit it, then we say, right, great, you can now do it, therefore you should be at a much more reduced risk of injury.
Yeah.
So that's an easy thing for patients to understand and see for themselves why am I here? What am I doing? From acupuncture, what's the equivalent as such, or is there an equivalent?
Yeah, there's different sides. So, like you say, if someone's got a big issue or an important issue, that is then easier to almost manage because.
So let's do that. Let's go with the glaringly obvious.
Because, someone comes in with something really serious. They have been constipated for a week, or their periods have stopped, or so it's something really important. That's a bit easier to manage because we have a little bit of a guideline. Now, the guideline is different for everyone.
Fine, so you're saying the guideline there is the metric is...
Yes, the metric that you would have.
It's not a week now, I've passed, my bowels have moved after day 3, rather than day 7.
So we would absolutely be looking at that. But equally, it is important to recognise, as you said, that everyone has a normal, and we're not trying to drastically always change everyone's normal, because for some people, keeping going on about constipation, but for some people, they're absolutely fine for them, normal for them, and it's not a problem for them to go, every 3 days or whatever. Obviously, one could always argue that's not normal.
Yeah.
But again, we're not going to go into that too much. But for some things, especially if it's not interfering too much, it can be left as their normal a little bit. But it's always involved in the thingy. But to go back to your last question, I think how we view medicine, and what we do is medicine, we're healing the body different ways. In the West, we view health as if you don't go to the doctor very often, right? So your relationship is always you could say very far, I don't ever go.
So therefore
I must be healthy. Whereas in the East, it's complete opposite. So obviously more, more so in the past when it was But, they would show off at how often they go to the doctor. So it would be, well, I go and see my Chinese medicine doctor once a week. And then, well, I go twice a week. So that makes me healthy. Well, I go every day. So it's a completely different thing, because with Chinese medicine, it's not about, the more you go, you must be really sick. No, actually, I just really healthy. I have a really good relationship with my acupuncturist. I see them often, even when I'm okay. And, so it's just, and I don't expect everyone in the West to have that mindset.
It's almost glass half empty, glass half full analogy, because it's the same thing.
So probably like physio as well. Even if anyone off the street, if I pulled the next person I saw off the street and brought them in here, they would be able to benefit from acupuncture, even if they were having a great day. Because there's always something that we can do. Every time we put a needle in, we're changing something inside the body. If someone's got a lot of heat, simplifying massively, but we're going to clear some heat. If someone's stagnated with energy stuck, then we can start to move that.
So following on from the things that you're talking about there, what would be the... again, I'll come back to my knee thing. The metric of improvement is the ability to be able to push more on the leg press. So they should see a gradual change in to reach that number. How do you measure progress? Is it simply based upon the feeling that the patient gives, or are there some really clear objective things which people should almost expect? So I'm going to talk again from physio point of view. Within 6 weeks, I expect to see big changes. If they follow up my advice and my programming, I expect to see big changes on that leg press thing, because I know that from a biological standpoint, the sarcomeres take 6 weeks for them to actually grow and either lengthen or thicken to increase muscle mass.
Yeah.
So in my head, I'm there like 6 weeks, there has to be a change in that. It's undoubtedly going to happen if they stick with what the programming is. Yeah. Do you have things in your head with, and you can use specific examples of specific conditions where we say, listen, we know that this is what would happen, or and even again, there would be an outlier surely on that leg press thing, but I'm kind of like, listen, I'm confident, I'm going to back myself with this. Are there certain ways you would back yourself in the acupuncture world with certain conditions where you're like, this here is like constipation, for example, going from 7 days to 3 days, it's a clear metric where you're like, I know from my experience, from what I know from research, this is like give me them all day and I'll prove to you that we deliver.
I mean, I wish in a way. In Chinese medicine, it's not so set in stone. It is very much down to the individual. So their constitution, how long they've had the issue.
Constitution.
So that's maybe more of a Chinese medicine.
Maybe.
So we're all born obviously with what we inherit from our parents. And that can be strengths and weaknesses. So, for example, if our parents are very emotionally stressed when they're pregnant or giving birth, that could lead to the child, from a Chinese perspective, having an energy slightly lower in one of the organs, for example.
Interesting.
So, if you think about children born in all different situations, good and bad, that kind of gives us our pre-heaven constitution, as we call it. Then we substitute that and supplement it with our lifestyle. So by living healthy, living well, we supplement that and we can overcome it. But ultimately, we all have a constitution where, and this is more 5-element acupuncture, which I'm not, but so one of the elements or two can be either very strong or very weak, for example, and that is going to show up in how you either, when you're ill, how it affects you. So, for example, an easy way of looking at it is so when you get sick, how does it affect you first? So some people say, it goes straight to my chest. Other people, it goes straight to my digestion, it goes straight away. Other people, I always get a headache, or whatever, or my lower back goes. So that kind of ties into what our constitution is. And that's part of you. So we can strengthen it, we can work with it, but ultimately, so someone's constitution, how long they've had the issue for, how severe it is, what's going on in their life. So is it work related? Is it home related? Are these things able to be changed or improved? Because that's massively going to affect the results as well. So I can have an idea in my head, like, okay, I can, most people come in with acute constipation, then I know that after one treatment, they'll definitely feel better. Especially if that's not normally an issue for them. If they come in one day and go, I'm feeling a bit constipated, after the treatment, I incorporate that into whatever else they're coming into, and normally it helps straight away.
Time frame, would you say?
So normally by the time I see them again, they'll go, I was much better after the treatment. Okay. But that's something that's, they're just kind of mentioning in passing. It's not chronic constipation. So
fair.
Obviously chronic constipation is different.
Of course, it's the same with chronic pain in physio. One session is we're not expecting vast changes.
No.
But normally if someone has just the acute side where it's just, this is weird, my knee hurts.
Yeah, it's just started. So the more acute something is, then normally the faster we can resolve it, for sure.
Excellent.
Yeah. Excellent.
Okay. This is really good so far.
So the only thing we haven't mentioned is about so who should come and what I said the other day about actually you don't need a Western diagnosis. Like, you don't need to be having serious issues, you don't need to have something really chronic, or you don't have to be really in a big problem to come for acupuncture. You can literally be actually feeling great and want to just maintain that. Or another good way with women as well is I can treat you based on just your menstrual cycle. So even if you're feeling pretty good, but your menstrual cycle, just by telling me in great detail what your cycle's like, that is enough to give me information to be able to treat.
For example, how do you mean?
So
I'm not clued enough up that way, but I understand the cycle, there's 4 phases of it.
So for example, if you speak to every woman and ask them about their cycle, they would all say completely different things because everyone has it very differently. One person's heavy is not another person's heavy. I can, with a woman, I can just take a lot of details about their cycle. Is it early? Is it late? Is it heavy? Is it scant? Is there pain before? Is there pain during? Is there pain after? That paints a really clear picture about what's going on with their body, and I can treat based purely on that.
Okay, I'll be a female. I have really heavy periods and I have pain leading up to it, which always tells me it's about to come. What does that tell you at the moment? Or do you need more info? And ask me the info you require.
Yeah, so I would definitely ask for more info. But even from what you've told me so far, so what we want is a little bit of pain just before is okay, because obviously we're getting shedding of the lining, so that's okay. And what it tells me though is that there's a bit too much, there's not enough movement, if you will. So that pain beforehand means that we've got what we call blood stasis or chi stagnation. So based on even just that information, some of the guidance I would give to that person would be that they need to move more, like before their period. So not excessive exercise, but walking, for example. Walking is going to help to move that chi, move that blood. It's going to help with the expulsion.
Interesting. It links in a lot with what happens in the physio world of people feel like pain, they shouldn't move.
Yeah.
But it's the professions align well with the fact that
absolutely, you've got to keep moving. Yeah.
Interesting.
And so I want to find out if someone's got cold in the uterus, which again can be very, very crampy pain and feeling very cold. So you're going to need to use heat to help.
So how does the acupuncture help here in this specific scenario? So I've got the pain, I'm heavy, and then you're saying walk, okay, I can do that.
Yeah.
I'm assuming it's not going to necessarily, it will change a little bit. I'll be surprised if that alters my whole thing.
No, it can take a while. So anything to do with gynae, with digestion, really won't be working together for 3 months, really.
Okay,
yeah.
Wow. And how often would that be?
Weekly sessions for 3 months, ideally, is the commitment that you can give.
What should I expect to see at the end of that 3 months, though? If I've included the extra walking as well, taken on board the guidance?
Yeah, so depending on exactly what you're presenting with in the first place, like we're easing this. And I mean, acupuncture is only one part of Chinese medicine, so herbal medicine is of course another.
And you combine that with what you do?
Yeah, not everyone does herbal medicine, but again, medicine is food is medicine, so you can looking at your diet, but also taking Chinese herbal medicine as well can be really helpful for gynecological things. And
so what would I expect to see? What would you expect to see? Because the big thing, we have the same thing with physio, is that people's expected outcomes, they have to be managed. We have some people who come and see us and they want the wildest experts, and we're like, whoa.
Yeah.
But normally, like if I had to summarize from a physio perspective, if I'm seeing someone for 3 months, but the bottom line is, my expectation is I back myself here that I will get you better. And if I don't get you better, then there will be a bigger underlying cause than just whatever these symptoms that are presenting here.
Yeah.
I.e., there's joint destruction happened in there, like from a big tear. But it won't take me 3 months to know that. I'm going to know it sooner because based upon that 6-week thing I said previously, I expect to see changes in a short period of time.
Yeah.
So from your side of things...
Yeah, I certainly wouldn't say it's not like you're not going to get anything, then suddenly after 3 months everything kind of clicks into place. So it will be a gradual thing, constantly checking in to see kind of, as you say, it's impossible to almost get all the information in the first couple of sessions even. It's all about working with...
Would you expect to see... So if you're saying you're giving yourself the 3 months, which is standard in what we do as well, would you expect after week 1 and 2 for the patient to have a noticeable feeling of difference? It hasn't got to be huge, but starting to be like, okay, I see. I'm feeling the difference here. Maybe at week 4, to be fair, if we're talking specific about menstruation here, maybe it would be 4 weeks for them to see. But would you be confident in that if they've just had the period, we've got 28 days or 28 days?
Yeah.
Down 4 weeks, really, really specific. Would you be confident in that next session of them noticing a change?
Yeah, there should be some change.
Fine.
You might not feel obviously everything, and some things will improve before other things. Some things will be more stubborn, but we're looking for change, and sometimes the change can be things that you've not even noticed. So quite often we're focusing on the main 1 or 2 issues, when actually there's a lot of things that are equally as important symptom-wise and to keep an eye on. Many symptoms can decrease quite quickly, others can be stubborn. So again, it's that relationship of keeping in regular contact and having regular treatments and working towards it. So the diagnosis, if we call it, that we have in Chinese medicine is actually like a list, normally of like 3 or 4 patterns of disharmonies, we call them. And normally one leads to another, so it's a bit of a progression, and then what essentially we're looking to do is almost like reverse those ish. But from a standpoint of, are we treating, there's always a root and a branch, like a root and a branch basically. And sometimes we want to work a lot with the root and a little with the branch, and then we're kind of going backwards like that. Other times you want to hit the branch and the root at the same kind of level. So again, every person is very different, and there's a different approach to everything. But I certainly wouldn't expect someone to keep coming back and saying, I feel no difference,
Yeah, listen, same with physio. Normally at that point we refer on because we're thinking,
it's
this is more than what we thought
rare.
it was. Yeah.
And I would normally say with anything, to be honest, if you've had 3 sessions and you feel absolutely not different, there's either something else going on that we haven't discussed that hasn't come up because it didn't feel important, but it is important, or you're the small percentage where some things just don't align.
Yeah, so this is I'm going to lead into a challenging question here, because the argument is the same in physio here, and it is if you're saying there that right after 3-4 weeks or whatever they've seen no change, there could be something more different. Why does not everyone at first point of call go to the doctor, for example? And I'm going to answer that question myself from the physio, so you can see that this isn't kind of a acupuncture, what is it kind of thing, because we have that with scans. People often say to us, we might see them for 3-4 weeks for the knee, and then it's not making improvements. We suggest to them to have a scan, and the counter thing is like, why do you not just scan at the start? And the argument always is that a scan only gives me a small part of the picture, because you could have this evidence where people have massive tears of their meniscus with zero pain. Yeah. And there's people who have the tiniest tear in the world, and they're like, their knee's going to fall off. And so the scan doesn't necessarily give me much information. I use scans when things are not progressing how I would expect them to progress. But I don't need my scan at the start to tell me what's wrong. So how would that work from the acupuncture side of it? Would that argument being, if you're going to wait 4 weeks, let's take the menstrual cycle, for you to say to me, well, there's something bigger here, why did they not start with that investigation first to be told, this is fairly normal what you're experiencing, maybe seek alternative methods as opposed to medicine? What would be your kind of comeback for that?
Yeah.
That makes sense.
So sometimes it could be the practitioner's fault. Sometimes I might have missed something, or sometimes we might just be prioritising one technique over another. These things do happen. With acupuncture, there's never just one road to the end journey, if you will. There's many routes that one can take to get good results, and sometimes people just respond better to different either techniques of acupuncture or different styles. That's the thing. Acupuncture, there's no protocols, there's no set treatments. It's not like that because the body's so different. So sometimes we start with what feels the most appropriate, and then actually we might shift slightly when maybe a bit more information comes to light, or we realise, this isn't working as well as it could, so let's switch to a slightly different method. And that's not because we're inadequate. It's just what human body's complex, and actually sometimes we just gotta admit that some people just respond in different ways, and that's okay, because we're still never doing harm,
Fair. Why is it when I have acupuncture, I've had acupuncture before and my shoulder was hurting, and I'm pretty certain this happened. There was a needle put in my head there, and there was one in my ear, and a couple in my shoulder, and I was there like, this hurts, none of this hurts. Why? Let's forget about whether it was there or there. But why is it if someone comes in with an issue here or here, that the needles don't get put there?
Yeah, that's, I think, the biggest misconception. People assume that where the pain is like the most important thing. And obviously we're talking about pain in this instance. Where the pain is important information, but it's not the be-all and end-all. What we're actually looking for is what meridian is that pain on, and therefore what points are we going to use for that. So quite often we'll use mirroring channels. So especially if the pain is very acute, maybe someone doesn't want needles in that area, that's perfectly normal to not want that. So we can treat distally. We're always going to put points further down the channel. So if it's in the large intestine channel, we're going to start further down the channel. We're also going to start on, the opposite limb as well. So that's standard acupuncture practice. Yeah.
So let me go percentage-wise here then. So think about all the things you normally treat. How often, if you had to pick a percentage of I treat this number of things, and whenever I treat these, what percentage of needles go in the point of where the problem is? So let's take shoulder specifically to make this easy. If I've got shoulder pain, or no, I'm going to give you a different thing with MSK. I've got digestion problems, and it's here, it feels all bloated and uncomfortable. Where are my needles? How many needles are going here?
There might be 2, for example, one either side on the stomach channel.
Yeah.
The rest would be on the stomach and spleen channel potentially, on the legs and arms.
So roughly how many other needles in total? I've got 2 here. And
so yeah, so say on an average treatment we might have 10 needles.
Oh wow, only 2 in
yeah, only 2 in the abdomen, for example. Yeah.
Wow.
Obviously that we're talking hypothetically. So
of course, yeah. And it's interesting because maybe that is like you say, a misconception that people have. Pain is here.
Yeah.
Why are you not putting everything
Why are you not
here?
putting all the needles here?
Same in physio. If they're coming with knee pain, I keep using knee, and I do something on their shoulder, like, what are you doing, mate? It hurts here.
Yeah.
And I think that's a really important message for people to be aware of, that it doesn't have to go where. We use a saying in physio, which is you've alluded to a little bit, where the pain is, the problem is often not. So they might have pain in their knee, and it might be medial, but actually it's coming from the anterior part of it. To be fair, in physio, it's a little bit more local, so we can treat the area. You do get hip pain, which refers to knee, and knee pain, which refers to hip. It's few and far between, if I'm honest. Normally, if the knee hurts, it's the knee. So it makes our lives easier that the patient thinks. Like if I went to the dentist and my tooth hurts there, and they start doing something like that, I'm like, what are you doing, mate? It's here.
Yeah.
And definitely trying to get that message out to people that it isn't just a case of focus on where it hurts, but looking at the bigger picture.
Yeah, I remember someone having like vulva pain once and being really, really nervous in a chat that I had with that. Obviously, it was like absolutely not.
Yeah. Okay, yeah, I think that's
and that's a totally fair fear, obviously, to have.
Yeah.
But yeah, I mean, obviously, from a musculoskeletal position, I'm always going to feel around the area of concern. I'm going to look for archy points, which is what we call tender points.
Okay.
I'm back where I started filming this video earlier. Now, in that video, I ran out of battery, so I didn't get to finish off my questions, which is a real shame because we were just getting started. But Gemma has agreed to do more of these videos in the future and give us more golden nuggets on how acupuncture can really help you. Now, I really hope you enjoyed that video. If you did, like, subscribe, share, leave a comment, do all the things that YouTube encourages you to do. And that will massively help us share what we're doing and boost our presence, which is what we're aiming to do. Hopefully see you soon.